Hi, guys. Thank you for joining. This is Essence of Medicine. Today, we're going to do our spine terminology series, and we're going to start off by talking about flat back syndrome. I'm Amanda Armagast.
Dominic Moore.
And I'm Dr. Abbasi for Essence. Flat back syndrome. Yay. My favorite topic.
Okay, what is flat back syndrome today?
So flat back syndrome, what do you understand what flat back syndrome to be?
Okay, so obviously I'm not a spine professional. My understanding of flat back syndrome is when someone loses their lordosis. So maybe if someone has spine surgery. Yes, I know.
I know, I'm telling you, she's learning too much.
I've been here for like 4 years, you guys. I would hope by now I learned a couple things, but maybe if someone has a fusion and they overcorrected the lordosis or something and now it's flat.
Well, if you over lordosis, you have hyperlordosis.
So they went the opposite way, is what I'm saying.
When you get rid of the lordosis, then your back becomes flat.
And sorry, guys, but what is lordosis? The curvature of the spine?
Not you are going back.
No, I know what it is. Come on now. No, I know what it is.
Hey, chalk it up, Dr. Abbasi. That's 2 words.
Yeah.
2 words.
Lordosis is the curvature of the spine.
Nice. So, we talked about that humans are upright. So, for us to be able to be upright, we have to have certain curvature in our spine. Can you repeat that, please, Dominic?
Yeah. So lordosis is the inward curvature like this. So you're looking at me from the side.
Bending forward.
Yes, exactly.
Bending forward, lordosis. And your neck bends forward.
Yep. Neck and lower back.
And the chest moves backward. It's called kyphosis.
Yeah, that rounding there, you see? I mean, I'm exaggerating it, of course. But
yeah. No, you don't walk like that? I
try not to, but, some days.
No, the forward bending of the spine is called lordosis. Well, why is forward bending of the spine normal? Well, what is normal?
Well, you need it to take the pressure off.
And you hate that, but it came about 1.2 million years ago when we start being upright. For us to be upright, as other animals, they have just the kyphosis, but for us to be upright, we have to have this S-like curvature, multiple, in neck, chest, and so we are upright. Now, it is important as well because for us to be able to walk, our center of the gravity has to go. Imagine you have a tree that is leaning forward or a building that's leaning forward. You can imagine that is economically not sustainable. That building will fall, right? A building that's not straight up and the center of gravity is not along the axis of the building is not going to sustain its stability. In human body is very similar. All this curvature on the spine, they enable us that we call it actually C7, the line. When somebody's standing from C7 and line goes all the way down, and that has to be within certain vicinity of L5. And this curvature assured that that's exactly the case. Now, when we get older, obviously some of the angle get worse, they get more or less. In most of the time, I'm sure, Amanda, you have seen many people who get old, they become like a hunchback.
Yeah, I see that a lot.
What is it called, Dominic? What is that called?
The little kyphotic deformity.
Hyperkyphosis. Right?
Yep.
And in the lumbar spine, you can have as well hyperlordosis. That is as bad as if you have less of it. If it becomes less and less, and then you do a surgery and make it completely flat, that's so-called flat back syndrome. Now, why is flat back syndrome, why is it a problem? Well, what's the difference? I mean, as long as it falls across from our C7 all the way down, why is it important that curvature, why is it important that curvature is there?
To take the pressure off
Of what?
of the rest of your vertebrae.
No, I don't believe that. No, there is a harmony in our spine.
Mhm.
That if one curvature get worse or in any direction get worse, the rest of the spine have to compensate to keep you still upright. Like imagine if your spine is bending too much forward in one direction, then the other part have to bend the other way to make you still straight up. Yes, that I give you.
Mhm.
It's mostly about the dynamic of our muscle.
Mhm.
Look, see, when you try to pull something with your arm stretched all the way versus you try to pull something with the arm 90% flexed.
Mhm.
Both of them are not the best. The best force you can produce with your arm is when it's about 75% stretched out. Between 75 and 25% is you can produce the maximum force.
Mhm.
Try it out. Any muscle in your body.
Yeah.
Okay? Try to lift up something or try to do anything.
Okay.
Within 25 and 75% of the contraction of a muscle, that is where you can produce maximum force. Anything beyond that, it tires out so much faster.
Mhm.
So does flat back syndrome like occur naturally with age
Yes,
or
it can. And our body, our musculature are as such that they work best in that limit, within certain curvature of the spine. If the curvature of the spine gets worse or less, it is more or less the same as if you're using the first 10% of the muscle or last 10% of the muscle. It's just not economic for the muscles to act. And now we talked about that. Now it makes sense why, when you are fusing somebody, it is less of a factor than is if you just, now if you fuse everything,
Mhm.
but the axis still in the spine, the muscle have no more action.
Mhm.
So that become less of a problem, but still important because your balance, your weight still have to go within this parameter down.
Mhm.
Now, Amanda, who is Lordosis?
I don't think I can say on here.
No, but who do we call Lordosis?
Oh, the people who are more obsessed with fixing the photo. So they see a photo of a patient before and after their surgery and they say, "Where's the lordosis?"
And they
But
never
they don't
ask.
really say, "How does the patient feel?" or anything like that.
Yeah.
So I would say it's people that are more focused on the image than the patient.
So, people who see in a patient surgery just a Photoshop of how these angles look like.
Mhm.
Those angles we know are extremely important, especially in what we know of juvenile scoliosis, because
Mhm.
these young people. Now, Amanda will hate that, but what does the word orthopedy means? Orthopedy. Now, orthopedic colleagues, the bone doctor, call them orthopedy or
Mhm.
orthopedic doctors. What does orthopedy means?
Ortho is bone,
Yeah.
isn't it?
But pedi, what does orthopedy means? Or ped, have you pediatric? Why is the
Mhm.
word pediatric in orthopedy?
Oh. I've never really thought about that because the pediatric is very much young or juvenile.
Mm-hmm.
So there's no way it's juvenile bones.
And pedestrian, someone on feet.
No, that is a different ped.
Yeah.
That is,
Mhm.
ped means child. Orthopedy, ortho means straight.
Oh.
Yeah,
Huh.
orthogonal view.
That
Straight.
makes sense. Yeah. Okay.
So, orthopedy is the science of making the kids straight.
Wow.
Learn something again. Huh?
Yeah.
Mind blown.
For some reason, that one sits weird. I don't know.
But it makes sense. The whole
Hmm.
field of orthopedy come from these children with
Mhm.
juvenile scoliosis, and they had to make these kids straight because they weren't straight.
And I mean, if I think about other bones too, I mean, like if you go into orthopedist because you need a cast on this, I guess I am making my arm straight.
Yeah.
Well, mostly scoliosis. These
Hmm.
people who had a bad back, juvenile scoliosis, and they found out they have to make them straight in certain way, because if they don't make them straight in certain way, the problem aggravate. It becomes worse and worse and worse. It is like a little thing that you have to make it straight in within certain angle. Otherwise, those angles get worse in either direction much faster. So, and then they came with this what we call parameter, deformity parameter. That, like Dr. Kim has a very good talk I have put on YouTube as well, that talks about, you watch those angles, you correct those angles to a certain degree. These kids are going to live hopefully 50 years with that, and they're still growing. If you don't correct those angles, they're just going to go the wrong way. Now, imagine all the knowledge you regain from this. Some eminent spine surgeon just come and say, yeah, we are going to use the same thing for everybody else. Now, imagine, if you use the same tool that you're using to fix your car, you want to use that to fix your airplane. It is, and then it is almost like a cult now. When I put something down in LinkedIn, some people say, that is a hill I want to die on. You're a doctor. I mean, why do you talk like that? Who are you?
Yeah, like what do you think?
Who do you think? Well, is it a religious war or something? No, it is, and as a matter of fact, in the last 20 years, it has become like a religion. Everywhere you go, like I was showing our 22-minute spinal fusion in our center to a group of other surgeons. I was expecting, somebody asking me, so how is the patient doing? How long have you followed up the patient? What is the outcome of the patient? How long does it take them to go back to work? How do you manage the pain? They watched that 22-minute spinal fusion, which is a miracle by itself. The first question was, how is the lordosis? Show me the lordosis. Completely void of the practically essence of humanity. Is what we are doing is the patient. How's the patient doing? No. What is the angle? What is the angle doing? And certainly those angles have a certain legitimacy in certain parameter. And what we know, good paper are coming out there, correcting those angles in degenerative, like 70-year-old people, does nothing for you. As a matter of fact, if you overcorrect them, then you're overshooting. You remember, everything has to be within certain things. Those angles are age-related. Now, you get this surgeon, they look at the picture without asking what is the patient doing. They have all the plan, what to do. And that plan is doing T4 to S1 fusion, a homologous 2-day fusion, to avoid the flat back syndrome. That is what we are talking about. And the fact that surgery has 60% complication rate, 25 to 40% infection rate, 5 days hospital stay, 3% mortality rate. But what is the lordosis doing? Did you fix the flat back? And for some of them, flat back is a term that is, I think, as well, is overused. Every time you want to criticize another surgeon's work, you call it flat back. Well, 7 degrees, then 12 degrees for you. As a matter of fact, half of the LinkedIn spine post is how proud they are that they corrected 7 degree to 11 degree. And just the idea that you can do a 2-segment fusion and then correct those angles, and then that angle tell you how this patient is going to be. Why aren't we clinician? Follow that patient instead of taking that number for an indication for an outcome. Look at the patient, follow the patient, and look at the actual outcome, not the perceived outcome based on the numbers. So coming back to that, flat back syndrome is when your lordosis is less than it should be. It has a legitimacy for some practically the symptoms, especially in children. Is extremely important that those numbers are corrected within certain parameter. It is widely overused. If anything, I think, I mean, not a conspiracy theory, but I think this device company have created the fanatic group of people that they go like, have you seen in one of those political things that there are some few people, they just go there and shout. They have nothing to say, but they just start disrupting. There are very few, but they are very loud. There's a same number of surgeons, spine surgeons out there. They just shout, and their solution for that is doing a bigger, 5 times bigger surgery. The justification is that because you want to avoid flat back syndrome, you want to restore the lordosis. Not that, and in truth, it is unfortunately almost like a cult. No, flat back syndrome is not a cultish thing, it's real. But overusing it becomes a cultish thing. Okay? Like if you want to shut up anybody, you say, you just call them anarchist or a socialist or something. Then you just give them a name and to shut them up, you know? So
yeah, but the people that receive those names, like if they know that's not really them, then they don't care. Like for instance, when people are like, where's the lordosis, this and that, you're like, ask how the patient feels.
Yeah.
How, if a patient has flat back syndrome, what would that feel like to them, and what would be usually the solution for that?
Well, the best way to treat the flat back syndrome is to avoid it.
Okay,
once you have flat back syndrome, if you still have mobile segments, you can do posture control, physical therapy, Pilates, yoga, and so on. But if the bone is growing together flat, the correction would be breaking it and putting it back together. That is extremely invasive procedure. In my opinion, there are very, very few cases that the surgery of that magnitude is truly justified.
Okay, well, we have to go. Thank you guys for watching. This was Essence of Medicine. We talked about flat back syndrome. I'm Amanda Armagost.
Dominic Moore.
And I'm Dr. Abbasi for Essence.
Have a good weekend.